There are first 10 track countries, including Cambodia, Bangladesh, Vietnam. Interestingly, 3 are African: Ethiopia, Rwanda, and Egypt. Now, these have used the most basic of interventions, the ones that have always been known, to ensure that women's and children's health is highly prioritized.
When you invest in girls and women's health and rights and well-being, there's a ripple effect that not only benefits herself, so it's not only an individual benefit, it's a benefit for the family, for the community, and for the nation.
Egypt has decreased under 5 mortality by 75%, from 80 to 23 per 1,000 live births between 1991 and 2013. They've equally done well with maternal mortality.
What Egypt is very clearly known for is really making those services available, and that mothers are able to deliver with a skilled birth attendant.
In Rwanda, almost 70% of parliamentarians are women, the highest number of women parliamentarians in any parliament in the world. The young nation has also done what the Abuja Declaration demands of African governments in honoring the health budget.
They invest more than 15% of their budget in the health sector. Uganda is doing so at half, almost just 8%, 8.5%.
In Bangladesh, the woman, according to their state minister, practically takes the lead.
That we got the MGD4 and we expect to get the MGD5. The main thrust was on the women empowerment. That is to educate the women, to give employment to the women, and to give justice to the women, and to remove inequalities in the society.
They know that women are most affected and women are sources of production. So by investing in them, by involving them, they have made a difference.
Bangladesh has also improved tremendously in provision of medical services, including building up a strong qualified health workforce.
Investment in the health sector in Uganda has been driven a lot by donors. So donors have invested in malaria, have invested in immunization, have also invested in other programs, but not so much in terms of maternal and newborn care. And the government has not bridged the gap.
Leadership as well, which partners at the Partnership for Maternal, Newborn and Child Health PMNCH Forum have called for, is enforced. The same is highlighted for all fast-track countries. In the region, Ethiopia has demonstrated this well.
What we are demanding, it is a responsibility and a sole responsibility of our governments to do. I think any government on this continent has to be really cautious that whatever is the progress we have made, it is far behind what we could have done.
For Uganda's situation, according to Dr. Peter Waiswa, a public health specialist who lectures at the Makerere University School of Public Health, even if there has been an increase in many women giving birth in health facilities, it doesn't translate into reducing deaths.
There is no improvement in quality. We have limited skilled staff in terms of midwives, in terms of doctors, in terms of emergency obstetric care services.
He fears that the implementation of a new action plan the country has for women and children may just never happen.
The sharpened maternal, newborn and child health plan, which is also for reproductive health, has used evidence to come up with a plan. They've also tried to look where the resources would come from. It is almost coming to a year since this plan was launched. The plan is meant to expire in 2017. Okay. The time is short.
So true. Most fast-track countries have prioritized education, especially for girls. Significantly reduced chronic malnutrition in under 5, like Peru, from 27 to 17%. Increased access to improved water sources, like Egypt, from 93% in 1990 to 99% in 2011. China has done equally well. Others are deploying health extension workers like Ethiopia for women's and children's primary care, while others have increased contraceptives, which have reduced fertility rates like Nepal, from 5 children in 1991 to almost 2 in 2011.
Dealing with the real instant killers like malaria, if you can eliminate malaria, then you can reduce a lot of infant mortality.
The challenge to Uganda now and other countries that are dragging their feet is in the success factors for women's and children's report, with countries that are not overly rich, faring very well in reducing deaths of women and children and improving their well-being.
Those needless deaths are still an indictment against all of us.
Florence, NTV in Johannesburg, South Africa.